everyone, it's Dr. Fatemeh here. I hope you watched and enjoyed my first video of the playlist, Second Chance. Second Chance was something that I created for myself with the action I took towards cancer. And I am hoping and believing so that I can help by spreading the awareness and spreading the information with you guys. And you can obviously share that with your family and friends, so that we can have a big community and knowing the more things about cancer and being able to help ourselves and our community. So this morning I had a talk which was for a health hub, which the information, by the way, is just down below under this video, through a good friend of mine. And I talked about my cancer for half an hour, and I think it covered a lot of points, and I think it's really good if I can have it here for your attention. And I would love you to watch it and then send me some comments, some feedback to say what you think of the journey that I had, and would you be prepared to have similar action to, not to cancer, to anything else. And by the way, as I always say, I am not giving this information to you to kind of drop your treatment and do something different. No, this is all because I want you to believe in what you do is going to help you. Okay, so here we go. Have a look at the video and tell me what you think.
So I'm delighted to welcome today Dr. Fatemeh, who's going to be talking about a topic that's very dear to her heart, and some of us in the audience as well, about cancer. So thank you for joining us, Fatemeh, and over to you.
Thank you so much for inviting me, Elaine. It's a pleasure. It's absolutely a pleasure to be here, talking to people that are thinking like me, talking about the things that interest me. So I am very happy to be here. Obviously, not many people know me in here. My name is Fatemeh. I have a doctorate in physical therapy. I am a multi-award winner physio. For the last 7 years, I have been awarded 7 awards for the care that I have provided to my patients as a physio. But that's not my whole life. My whole life is on what happened to me 2015. So 22nd of October 2015, I was diagnosed with cancer, a 6 centimeter tumor in my right breast, which had already gone to my auxiliary nodes and involved them. So when I got the news, obviously, as you can imagine, it was all crying, why me, I'm a good person, you know. It was like in my head, no, I wouldn't have the cancer because I've always been looking after others. And it's always been me, the person who been strong, who been kind of go-to person in my family, within my patients, with my colleagues and everyone, not knowing that dealing with all those traumas, I was just building up a blockage of energy in myself that obviously caused that cancer. What they said was the cause of my cancer was the HRT, because before that, in 2007, I had a total abdominal hysterectomy, which went completely bizarre, and I lost my life on the table. They brought me back after, I think, losing 2 liters of blood on the table. They brought me back, and I knew somehow in my subconsciousness that this was given me as a chance. But obviously at that time, I was a physio. I would just treat and listen and believe in the things that I could see. Your arm, your leg, your neck, headache maybe, migraine coming from your neck and stuff like that. So nothing apart from physical world really was known in my little world. So I think Elaine has read my book because she mentioned about my spinal surgery. And I was thinking, how does she know about my spinal surgery? And then I thought, oh, that's only in my book. But anyway, so before having cancer, I have had bad days. You know, I've been the little girl who's been always ill in the family. I was the ill one in the family. I was the person who wouldn't put weight on. who the parents were all the time were worried about her. Why is she ill about? You know, why is she having this problem again? So I was back and forward to hospital in my childhood. I remember numerous visits. Obviously, at that time, I was in Iran, Tehran, where I was born. And bless them, my parents were very, very kind of caring about me, taking me to different doctors. Why is she so slim? Why is she so ill? And this illness continued to change its course during my adulthood. So coming from endometriosis, for example, which I tolerated from the age of 16 to the time that I had everything out in 2007. So I think I was 40, 45 something at the time. So I tolerated it because I thought I can deal with it like we do, all of us, but it was so bad that I couldn't breathe when I had the pain. So they had to do the operation. So before that, as a young person, I used to play volleyball. I used to do a lot of, fitness, and even though I had a lot of pain and different diseases, I still continued to be very active and very positive and all that. But it came to the point that I had to have a spinal surgery, and I had fusion in the age of 28. I was pregnant with my son. After the son was born, I couldn't stand on my feet. And the sciatica was, I know what sciatica is now, but obviously at that time I didn't know. So the sciatica was so bad that I was bedridden. So we had to do something about it. They did a discectomy at the level of L4, L5, which is very common. But though obviously I'm 61 now, 28, it's a long time ago. So there wasn't many options of dealing with this surgery. So I had to have a fusion. And that changed my life a lot. I couldn't do the things that I love to do, like running, like, excessive exercises, because I didn't have a disc between two vertebrae at the bottom of my back. So that is the fusion. So I was told you will probably be okay by 20 years, and after that you might have to change the fusion. Well, I never did that, I'm still living a life full of activities, thank God. But then I learned from that experience that I should do something so that other people don't go through what I did. And the difference that I have to everybody else, that I can't do different things that I love to do because of the fusion in my back. So I immigrated to England, I think I was 34, and started to do college and learning, the language and everything, and then gone to university straight away. Got my BSc in physio and continued doing online study until 2010, which I got my doctorate. And it was just like, yes, now I can help people, now I can do things that others couldn't do for me, but I can help people now. They don't have to go through the surgery I had. But this time, cancer was really, because I lost my mom to cancer, I lost my auntie to cancer, I lost my grandma to cancer. So when I heard the news, cancer, it was like a block in front of me. I thought, no, this is not something I can learn from and share it with others. It's not like my spinal surgery, it's much bigger. So it was devastating for the first week. And when I was introduced to the oncology department, I saw the oncologist and I discharged myself. I said, this is not who I want to be seen as a patient. I've always looked after the, other people. And I just, with all respect, I just don't want to be hairless and, vomiting and my community, my family to look after me. I am not that kind of person. I just deal with it as it comes. And at that moment, very moment, I had switched on a thing in my brain without knowing. When I say brain, not even brain, in my mind, in my subconscious, that I didn't even know what it was. Then I started to research about things. I spoke to my brother, who is really dear to me. I love him so much and I look up to him for everything. So I spoke to him and he introduced me a site. It was The Truth About Cancer. And the 6 to 8 months that I was given, I just spent that in learning, listening, crying, talking to other people to see how they have done their treatment. And I realized something that you will never, ever hear in the news, that there are more people who have survived from cancer than the ones that die from cancer. You will never hear that in the news, the mainstream news. You will never hear that. So then I started to, after learning so much, I started to do different courses. And by then, I knew something had happened in me, but I couldn't just put my finger on it and say, yes, I switched brain, or my mindset is changed, or I'm a stronger person, or this idea. It was just something that I didn't even know what it was at the time. So I started studying herbal medicine, medicinal food, anything and everything that you can think of. I said, I spent thousands of pounds to learn about me, about Fatemeh, the physics of Fatemeh, the energy of Fatemeh, the frequency of Fatemeh, vibration of Fatemeh, and the power of her mind. And that took me 8 years. Okay, so between 2015 and 2022, I just studied, I just worked on myself. I had forgotten almost that I had cancer. I just remembered how my mind kind of guided me, the inner voice in me guided me through things and said, Fatemeh, don't, even the roll, that you use for underarm, don't use this one, try that one. I juiced with the power of mind. I mean, somebody was telling me, in me, to put this together, add this together, and, just see the results. So obviously, as you can imagine, in England, they just push you to go to hospital. They just chase you up with appointments. And I had obviously so many of them. I agreed with myself that I go for one more time to the department to see the things that I've been doing, juicing, change of lifestyle, the way I've been thinking differently and all that. Would I have done anything in terms of treating my cancer? And it was, to my very surprise, because I didn't know if I had done anything, I still was alive, obviously, and I was happy, and I was a lot happier than before having cancer, but I didn't know why. So October 2015, I was diagnosed, and August, I think, 2016, I just said yes to one of the appointments. I went there, they did the ultrasound. They said, the nurse said, what have you done? Your auxiliary nodes are completely clean. There's no cancer there. And the 6 centimeter, which was 8 centimeter plus, including the inflammation around the tumor, is gone down to 4.5. So the tumor now is not even 3.5 with the inflammation and everything. It's 3. So nearly halved. And I was like, really? And she said, yes, what have you done? So I saw the consultant. I thought, oh God, she's going to say, fine, you don't need chemotherapy. You don't need this. You don't need surgery. I was supposed to have double mastectomy, clearing of both underarms, radiotherapy, and chemotherapy. And I was told, if I had done all of them, I had a chance to be alive for 5 years, and it might have been the chance that cancer would come back in a, higher grade. So thinking that, the obviously consultant is seeing my result, and she's going to say, what have you done? Come and tell us, let's work with the other cancer patients. No, it wasn't like that. She just reminded me how strong the cancer is been in my family, the family history. She reminded me, I didn't even know where she got this information from, maybe my GP or whatever. that your mom, every feminine close to you in your life died from cancer. Don't forget that, Fatemeh. This is just a small change. This is just very little. Within 8 months or 10 months, it's just a small change. But to me, it was a major step forward. And I was like, you know what? I'm just continuing doing this. I don't care who says what. And I never, ever went back to that department ever again. And that was it, the end of hospital for me. So then, after learning all of that and, doing all of this, working on myself in 2020, end of 2020, within the lockdown and COVID and everything, I got this massive message, whatever you call it, download, whatever you call it, awakening, that, I am now in the right direction. I'm doing the right thing. And the inner voice got a lot stronger now, telling me how exactly I could help other people, how exactly I should do courses, I should write a book. And I was like, really? It was like my teacher was telling me what to do. And it was just unbelievable. The person I was within 2020 till 2023 was just out of this world. I had the highest frequency I could ever imagine, not seeing anything wrong with my life, even though there was the lockdown, there was this, I had lost my job because my job at that time was very obviously hands-on. They had to change it to online later. So I was just the happiest. And the more happy I was, the more money I was receiving, the more attention I was receiving, even though I didn't kind of work for getting attention. I just wanted to be known for what I could do to help others. And it was just unbelievable. And then only then I started to learn about the power of mind. So everything has been physical until that point. I thought it was physical anyway, So I did the juices, I did exercises, I did breathing technique, this, that, the other. But in 2023, end of 2022, I spoke to my very good friend who is a very well-known mind therapist in England, Matt, and I said, I was just obviously on the phone to him, and I said, I don't know what I've done, but I'm just a different person, and I don't know how I managed to cure my cancer. I still don't know. Was it the juices? Was it this? Was it that? And he said, what you had done, Fatemeh, is called SSU, split second unlearning. So within that kind of burst of energy, the second week of diagnosis, when you spoke to your brother, he knows my brother as well, when you spoke to your brother and when you went to find better news that more people are alive from cancer than died, then that gave you this kind of confidence, and it boosted your kind of frequency enough so that you kind of discarded all your beliefs about cancer. Even though you've lost so many people in cancer, with cancer, you kind of just killed all the beliefs about cancer, and you just made a good belief for yourself and said, I'm going to survive from this, and I'm going to share my knowledge with others. And at that time, I was like, SSU, what? I started to write my book, and I finished my book by my birthday, 2023, which is out, my book, I'm Still Here, to the Cancer Which Changed My Life for the Better. And so it was the power of mind. Now that I have learned that, guys, you have no idea how easy life is for me. I mean, whatever you said, all of you ladies, you beautiful ladies said everything about, different methods that can help people, for anything. I just want to add one more thing to that list of yours, and that is the power of your mind. And it is so strong that can, I mean, if you don't have, to me, okay, I mean, I have not seen my GP maybe for 5 years now. I still get little things, you know. I had a fall and I broke my ankle. Obviously, I'm a physio, so I treated that myself. I've had ear infection. I've had this, that, the other, but I give the right tools mentally to my physical body to heal itself. And this is just another healing method added to your methods that you just mentioned. But I see this very, very, very stronger than anything else. I mean, imagine you have 6 centimeter tumor in your breast. I mean, my breast size was twice, as much. It was that big. I never forget that the consultant took it was an orange on his desk, and he took it up and he said, "It's this size." And that vanishes by itself. It repairs all the tissues that has been damaged, everything that happened without any medication. I mean, I was on, that consultant put me, I think it was letrozole, wasn't it? Yeah, it was a little tablet. She said the least that you could do for yourself from a medical point of view is to have this, to give you some, hormonal boost and this, that, the other. I took it for a few weeks, and it was just making me crazy. I couldn't go to work. I was so lethargic, painful body, my joints. So I was like, no, I'm not taking this. It's not going to change my life. I have better tools to go to. So even though I didn't know what their tools were at that time. So I only learned 3 years ago, 2.5 years ago, that what I've done, the technique. And my absolute aim is to help as many people as I can to know what they've got, the power of mind that they have, versus the physical things that they can do for themselves. Even, I don't know, instructing water, this, that, the other. I respect all of them. I love the way that you go find these things and you're happy for them, because that shows me how much you believe in different things and you believe that things can work for you. And that is good enough for them things to work for you. So what you believe is going to help you. I never say anyone, I mean, I have done so many courses. I have had so many transformational coaching kind of clients that have changed their lives. And I have never asked them to stop their treatment, to stop what they believe. I just want them to confirm their beliefs strong enough so that it works for them. So if you do surgery and you believe that that's the end of it, cancer is gone, it will be gone. Whereas somebody else could do something else. And so anything and everything that you said this morning before me is priceless, because all of them can help you if you believe that they can. So I think I've gone through all of what I wanted to say. I just wanted to briefly just say how cancer helped me, because the title of my book is To the Cancer That Changed My Life. The biggest thing that cancer taught me was to prioritize myself, because I never did before that. I mean, I always looked after my parents. They died. I looked after my family, my brothers, and then my husband, my children, my patients, everybody. Everybody knows Fatemeh, the physio, as the closest friend, because I just got so close to my patients, but not knowing all those traumas that I was holding in, trying to help others, was doing damage for myself. Saying no to others, I learned how to say no and be very strict with my boundaries. And that was the biggest change I think I needed to learn and have in this lifetime. I so much believe so. So if you ladies are happy to take part in a little, like about 2 minutes exercise, mental exercise, I would just like to share with you a practical way as to how your mind, how your subconscious can help you. Are you happy for us to do that?
Yeah, brilliant. Thank you. Please go ahead, Fatemeh.
Right. So I want you to just sit comfortably. I want you to close your eyes. Close your eyes. Close your mouth. So you are not talking at all, even though I'm asking you to say things, but you are just saying them in your heart. You are silently in your heart. You are not talking. You're not using your mouth. You're not using your ear. You're not using your tongue. Okay? So I want you to close your eyes and tell yourself in your mind, you are so beautiful. I'm so beautiful. I'm so strong. I love myself. I really do love myself. I don't need anyone's company but my own. This is a brilliant day. I love it. I absolutely love this day. And I want you to feel how you feel. And then I want you to open your eyes and tell me, did you manage to say that without using your physical body? Did you? You did.
Yeah.
Then you?
Yeah, definitely.
Did you hear what you said?
Yes.
You did. Did you feel even a little different feeling? Did you?
I personally didn't, because you and I have a similar story, and cancer is a wake up. It's not the thing that we're told it is. So I think I'm a bit different, but
Okay.
I feel like this all the time.
Even if you only heard yourself, so you managed to say that without physically using your lips, and you heard it without using to kind of be loud and hear through your ears. Now you know there is a bigger Elaine, a bigger Hannah, Fiona, Angela, Yvonne, Jill, and sorry, I can't see anymore else. And all these beautiful ladies here. There is a bigger power in you, which Dr. Joe Dispenza in his book says 99% of you. So this physical body of yours is just 1%. And how that 99% of you kind of act in your life is very much depending on your will. So how you want it to work for you. Do you want you to feel like exhausted and tired and ill and oh my God, life is so difficult. I hate this, I hate that. Or life is beautiful. And it has that 99% of you's duty is to say, yes, yes, it is. So you say, my life is, I think Jill, she was talking and I love to listen to her talking about everything is good, every day is good. And I loved it for this reason, because then her mind, her energy, the 99% of her say, of course, Jill, here is more of a good thing, because you want good thing. So you want good thing, they come to you. You don't want them, bad things come. So everything, that is the law of attraction. People say law of attraction, but we as medical people who've been studying a lot, physically, mentally exhausted with study, we would say is frequency. And that's exactly you guys were talking about today, especially Fiona, frequency. So you have the high frequency and you can have, God forbid, the low frequency. It's up to you how you want to order that for yourself. I think I have talked enough, haven't I? If there is any question, I'm more than happy here to answer.
We're going to take questions in a minute when I stop the recording, Fatemeh. I just want to say thank you so much. That was brilliant. And there's an awful lot that we're going to be talking about shortly once I turn the recording off, because I know there's going to be some personal stories come out. So for people who might be listening on audio, what's your website, please?
Yeah, it's Fatemeh, drfatemeh.co.uk. But I really like to invite all ladies here to my Instagram. My Instagram is the biggest place that I am active at the minute, and my YouTube. So the Instagram is Dr. Dr. Fatemeh, Fatemeh. MEH official.
So that's on YouTube and Instagram, Dr. Fatemeh Official.
So when you go on my Instagram, there is a link bio and you have everything there. You've got my website, you've got YouTube, everything there. But my Instagram is my home at the minute. I do a lot of activities. I've just started, after I started to kind of, talk about cancer in my YouTube, I just started to talk more about cancer because I am known as Dr. Fatemeh or Fatemeh the physio to my community. I have got, I think, about 350,000 people following on different platforms. The biggest platform is the Instagram I just gave you. So knowing that it's an English speaking community and Farsi speaking community, which is my native language, all posts are bilingual. So you get enough information. Don't worry about, I don't talk on videos, is all by caption and you get all the information. I mean, the things that I used in my dealing with my cancer at the time, that is 10 years ago. The juices, I have just started to put them up, so they might help you as well if you have joint pain, especially joint pain. If you have, I mean, exercises, I'm trying to do some exercises today, record some exercises today. So that would be my best place to start with. And there is a link there, link bio, that it's got everywhere. You can find me everywhere.